The WHO has this huge decision to make on Friday about the global health emergency. But as a layperson, what I don't understand is what's riding on that decision? How is that decision going to be made?
So every 3 months or so, the emergency committee that was established for COVID-19 under the international health regulations, it's a group of experts from people around the world who work with us to assess the global situation. We provide an overview of what's going on, how the collective response is going, what kind of impact is COVID-19 continuing to have around the world. And so they are looking at a lot of different factors, the epidemiology, the trajectory, our uncertainty about knowing what is going to unfold if we look at the virus and virus evolution. How are we dealing with preventing hospitalizations and deaths? How are we utilizing the tools that exist, diagnostics, therapeutics, vaccines, personal protective equipment? And they will take a decision and they will advise the Director General, but the decision lies with the Director General of whether or not we're still in a global public health emergency.
So two quick things I'd like to zero in on. What is the cost of declaring the global health emergency over? What would be the cost of that?
We have criteria, very clear criteria of when we declare a public health emergency of international concern. As this ends, it's a very difficult discussion to have because we look at this at a global level. All countries right now are in different situations for COVID-19 because of a number of factors in terms of their population level immunity, their access to tools, the political unrest or societal unrest, other factors that are, and a number of other factors. And if a public health emergency is declared over too soon, there could be attention that is pulled away from that unnecessarily or too quickly, where we still need that collective response. Now, I'm not preempting what they're going to say or what the Director General is going to advise, but it is really important right now that we still are dealing with the acute effects of COVID-19 as we learn to manage it in the longer term. But there are some costs. There could be attention costs, there could be financial costs, and those are things that we are going to have to factor as we go forward because we will not be in this emergency forever. And that's the good news. And we've said many times, we thought we could end the global health emergency in 2022. We weren't able to do that because we didn't have the access to these life-saving tools available for countries. We didn't reach these targets that we are looking for in terms of the systems in place, reaching vaccination targets, getting antivirals out. We hope that we can end that emergency in 2023, but it's going to take us some time to really get through this long transition of a really high threat emergency, which we're not in that same situation, but the threat is not over.
And you know, you talk appropriately about evidence. Evidence figures into this. The numbers matter. But you've got a country like China that's not being transparent about its numbers. So they're not telling the truth, and they're not telling the whole truth. So given that you don't have all those numbers, how do you factor that in?
So that is also a major factor. The uncertainty by which we can make these assessments is really growing. Surveillance has declined around the world. You give the example of China and the information that we need there to make a proper assessment of what's happening in China, but also the assessment at a regional and a global level. What we would like from countries right now to make these assessments going forward is really looking at burden. What is the utilization of hospitals and hospital beds? How many patients with COVID are requiring intensive care? How many of them need oxygen? How many of them are dying? We need that information from China, and we need that information from around the world. But we are struggling. And I don't think we should sugarcoat this. We are struggling with monitoring the virus because we don't have enough sequences from around the world. We are struggling with surveillance information because the case-based data is not an informative metric right now because testing has declined massively, self-testing has gone up, but this virus is circulating unchecked.
What do the trend lines tell you about what this current variant is doing? How bad is it? How dangerous is it?
We published a risk assessment a few weeks ago, and we're updating that risk assessment today because we have more information about this XBB.1.5. And what we know about it is that it's been detected in a handful of countries and more than 50 countries to date. So for XBB.1.5, we know it has a growth advantage. And that means that it has the ability to infect others, and it will outcompete other viruses that are circulating. So we have very little information on severity of this particular variant. And we don't have any data that suggests it's more severe. It does not have any mutations that would suggest it be more severe than other sublineages of Omicron, but it's early days.
Dr. Kerkhove, thank you so much for your time. I know you don't have it. We appreciate it.
Thank you for having me.